My name is Christy Casey, and my handler is Alexis, and I'm using my horse Zipper. Today we're going to discuss knowing your horse's normal, healthy habits and vital signs. Throughout this demonstration, I'm going to ask that my handler stay on the same side as me. This is for safety purposes in case the horse spooks and needs a way out so that we don't get harmed. Before needing to take the vital signs of your horse, there are other physical signs that you can look for. You want to make sure that their attitude is bright and alert and their bloom of coat, and just other personality traits that you know about your horse already. If anything changes, then that would be a sign that you need to take further vital signs of your horse. Our first vital sign that we will check is the mucous membranes. These can be found in the conjunctiva of the eye and the gums. You want to make sure that they are pink and moist. If they're dry or tacky, they could be dehydrated. And if there are other colors, such as blue would be lack of oxygen, red could be a sign of fever, yellow could be a sign of liver problems or jaundice, and white could be a sign of shock. While we're checking the mucous membranes, we can also check the capillary refill time. This is done by lifting up the gum, lifting up the lip, and pressing on the gum. And when you release, you want the color to turn from white back to its original pink color within 1 to 2 seconds. His did so he is healthy as circulation goes. Any longer would be blood circulation problems, because when you press on it, you restrict the blood flow to that area, and then releasing it is when the blood goes back into the area. In order to check your horse's pulse, there are 3 areas where you can check them. The external maxillary artery is behind the jawbone. The second place would be the radial pulse behind the back of the knee. And the third would be behind your fetlock. This pulse should not normally be able to be found unless there are problems occurring in the foot. It's personal preference whether you take your pulse from the radial versus the maxillary artery. I choose the maxillary artery, so I'm going to count the pulses for 15 seconds and multiply them by 4. So within the 15 seconds, I counted 9 beats per minute, which multiplied by 4 would be 36, and that's in the normal range between 32 and 44 beats per minute. Therefore, he is healthy. Another way to check your horse's hydration is using the skin pinch test. This you do on the neck where their skin is pliable, and we'll hold the skin up and release. And while we're releasing, we want to count and make sure that the skin goes down within 1 to 2 seconds. 1, 2. So he is fat. He is in between 1 and 2 seconds, which would be a good hydration state for him. And if he were to be dehydrated, we want to rehydrate him slowly. To check your horse's heart rate, we're going to need a stethoscope and a watch, just like when we check the pulse. And I'll want to be in this heart girth area right behind the shoulder and elbow. And I'll listen for 15 seconds just like I did with the pulse, and then multiply that by 4. And that was 8 beats per minute, and so he's in the normal range of 32 to 44 beats per minute. And both of these pulse and heart rates, they measure the same thing, and they can be elevated by stress or exercise, and whatever their resting heartbeat is, that's what we just checked for him. So he's in the normal range. The next vital sign that we're going to check today is the respiration rate. This can be seen on their nostrils and their flank area when they breathe in and out. The nostril is harder to see when they take breaths or smell something. So we're going to check the flank area. I'm going to count for 15 seconds how many breaths he takes in and then multiply that number by 4. I'm going to ask my handler to do the timing since I'll be watching his flank during this time. Go. Stop. Alright, so within those 15 seconds he breathed in 4 times, which multiplied by 4 is 16. And that is in the normal range, 8 to 16. And even though he's on the high side, we are outside of his stall and he could be smelling things or not at an actual rested state. But it's still normal. An abnormal respiration rate would be anything below 8 or above 16. This could be changed whether he's been exercising or running or playing, and he would be breathing a little bit harder at that time, or if he was in pain. But a resting rate should be in between 8 and 16. Our next vital sign is gut sounds. This checks for colic or any other stomach issues going on with the horse. I'll listen on 2 quadrants, 2 on each side of the horse, the upper and the lower. And I'll want to be listening for constant gurgling sounds. I wouldn't want to hear anything silent or hypermodal, which would be really active gut sounds. I'm now going to check the other side of the gut sounds. Alright, and just like I heard on the other side, they were constant gurgling, and that's a sign of a healthy horse. Our last vital sign that we're going to check today is his temperature. That is normal in between 99.5 and 101.5. To do this, you can either use a mercury thermometer, which before using you need to shake down below 80 degrees so that it can accurately read the temperature. You'll need to wait 2 minutes before removing the thermometer and then wipe it off with a rag when you're done. When using a digital thermometer, all you need to do is turn it on and wait for it to beep, then remove it. We're going to use the digital thermometer today, and to lubricate it, I'm going to use petroleum jelly. And coat the thermometer with it. Alright, I have it turned on. Just going to stick it into the rectum and wait for it to beep. Alright, it read 98.8, and with these digital thermometers, sometimes they can be off, and if I was really needing to check his temperature, I would go and use a digital or a mercury thermometer just to be accurate. Any temperature above 101.5 could be a fever and would be a sign of illness or overheating, and a temperature below 99.5 would be a sign of shock. Thank you for watching my demonstrational video on how to take your horse's vital signs. Again, my name is Christy Casey. Thanks for watching.